Hi, everyone. This is Anthony Cervania, a student of the University of the Pacific's Occupational Therapy program, and I'm here with another video for Move Up Health and Fitness's Young Onset Parkinson's Disease series. Today, we'll be talking about double dipping and goal setting. Before we begin, I'd like to go over the disclaimer and safety notice. The following video is intended for general wellness and educational purposes only. It's not a substitute for medical advice, diagnosis, or individualized therapy. Always consult with your physician, occupational therapist, or healthcare provider before beginning any new exercise program, especially if you have a medical condition such as Parkinson's disease. This video was created by an occupational therapy student under the supervision of a licensed occupational therapist. All exercises have been reviewed and approved for general safety and appropriateness. Use caution when participating. Ensure your chair is stable and have a caregiver or support person nearby if needed. If at any time you feel dizzy, lightheaded, or experience pain, stop immediately and seek medical advice. By choosing to participate, you acknowledge that you are doing so voluntarily and at your own risk. Neither the creators of this video nor the supervising therapist are responsible for any injury or harm that may result. Starting an exercise program can be difficult. In our lives, there are many barriers which can decrease our abilities to start or continue participation in an exercise program. Jess Vang notes time, the environment, and energy as factors. With the diagnosis of Parkinson's disease, Shootmajer noted three factors: body function, personal factors, and environmental factors. Body factors include the motor and non motor symptoms associated with Parkinson's disease, such as tremors and bradykinesia. Personal factors include the increased fear or decreased confidence, which have resulted, and environmental factors include the lack of social support or difficulty accessing support. To assist with overcoming these barriers, goal setting may be beneficial. According to Paxton et al., goal setting is a technique utilized to initiate and maintain health behavior, and according to Bailey, it assists with developing a plan towards achieving a goal. When meeting with a personal trainer or an occupational therapist, goal setting is important as it gives both an insight to who you are and what's important to you. And one way in order to make these goals is to use the SMART goal format. As seen on these slides, SMART goals are specific, measurable, achievable, relevant, and time bound. Specific means that you're able to identify a specific goal that you want to achieve. Measurable is the quantification of the goal. How are you going to determine if you are making progress towards the goal? Achievable is the selection of a goal which you can complete. Relevant is if the goal is something that you want to achieve. And finally, time bound means that you're setting a time frame for you to achieve the goal. In the next slides, I'll be going over two examples of SMART goals that are both specific to the gym and can be modified for meaningful activities to me. Starting with the first SMART goal, I will lose 10 pounds by the end of the month by going to the gym 3 times a week to complete my strength training program. It's specific as I'll be losing 5 pounds, and it's measurable because at the start of the goal compared to the end of the goal, I'll be losing 5 pounds. It's achievable as I'm following safe caloric deficit guidelines to lose 1 to 2 pounds per week. It's relevant as based on my fitness goals, decreasing my weight would be beneficial. And it's time bound as I'm going to be completing this goal by the end of the month. The next goal is centered towards a meaningful activity. So in 3 weeks, I'll be able to carry my pit bull for 1 minute by performing overhead carries 3 times a week. It is specific as I will be carrying my pit bull. It's measurable as it can be measured in two ways: the ability to lift 65 pounds, which is the weight of my pit bull, and the ability to hold that weight for 1 minute. It's achievable as I believe I can achieve this task within the given time frame. It's relevant as it relates back to something that's meaningful towards me and my goals. And time wise, I'm giving myself 3 weeks in order to achieve this goal. While goal setting is important, sometimes it's hard to make time to spend an hour or two in the gym. This is where incidental activities come in. Reyes Molina et al. In 2025 notes that double dipping, better known as incidental activities, are unstructured forms of physical activity which occur when participating in other activities. Examples of this include the increased walking time for when you park further away from your favorite grocery store, when you choose to take the stairs instead of the elevator, or when you participate in more active events such as dancing at a concert or taking a pottery class. Incidental exercises promote scheduled physical activities by creating a positive feedback loop, increasing energy, and assisting with cardiorespiratory development. According to Emerson et al., incidental exercise improves exercise behaviors. Koch et al. Notes that increased incidental activities improve energy and mood. And finally, Ross and McGuire note that more incidental activities are associated with increased cardiorespiratory fitness. And with that, that concludes today's video. Come back next week where we'll be talking about caregiver resources. As always, if you'd like to download the information shown in the videos or read more information from the references used, come check out our Google Drive in the description. Thank you so much for watching, and I'll see you all next time.